Hello and thank you for tuning into my YouTube channel Lapping Analytics. My name is Jimmy Lapping. I'm a psychologist and statistician with an interest in a range of topics that I talk about on this YouTube channel, including training and assessment in high stakes domains such as healthcare. And this video provides a preview of a new book in this context that is already available for pre-sale and will be launched with Springer Nature sometime next month, that is December 2024. If you have checked out my channel before and watch videos in Spanish from time to time, you may have seen this video here with the title Una metodología longitudinal para la formación sanitaria, or in English, a longitudinal methodology for healthcare education. In that video, I present the outline of a 3-year longitudinal project aimed at fostering interpersonal skills such as showing empathy in a healthcare context. In this case, a project that took place from early 2021 onwards and therefore still in a period of considerable COVID-19 pandemic waves. Although, as can be seen in the video referred to here, as well as in the book to be published with Springer before the end of this year 2024, this 3-year project took place in the province of Cantabria, which is in northern Spain. It was a collaboration between the Cantabrian Healthcare Service, Marqués de Valdecilla University Hospital, Virtual Hospital Valdecilla, and Janssen Spain. All the components of the project, design, development, training, research, innovation, have been documented such that any institution could develop something similar for their local context, resulting in, relatively similar or perhaps for some settings noticeably different outcomes and conclusions. This is the case because, as the information on the Springer website indicates, the book illustrates how to develop, implement, evaluate, and improve teaching programs for preceptors and residents, where preceptors are professionals who, as part of their work, have a responsibility of training one or more residents. Next, the book also showcases a systemic approach to the development of interpersonal skills, including showing empathy for preceptors and residents. And across the different parts of the book, there is a deliberate integration of research and teaching into a local healthcare context using a longitudinal mixed methods methodology. Without going into too much detail, as explained in the video in Spanish that I referred to earlier, although there are differences between healthcare systems across the globe, one can say that any healthcare system is a rather complex system of many different types of actors that at the end of the day are all interdependent. Among these actors, we find preceptors, who are professionals who do many things, including have a key role in the training of residents, who are professionals in training, and as part of that training will learn to master both specialty specific as well as transversal knowledge, techniques, skills, and attitudes. And of course, along with their preceptors, residents are part of teams that consist of several other colleagues as well, who all work together to the best of their abilities in order to contribute to the best healthcare, patient care, person care possible. Given the complexity of the system and especially of the problems presented by patients and ongoing challenges faced by healthcare teams, including having to work with limited resources and time, many of the critical errors in, for example, a hospital are not necessarily a result of a lack of technical know-how or skills, but rather a consequence of suboptimal or omitted communication in teams. And the central tenet of the project that lies at the core of this new book is that if we help preceptors and residents to work on their interpersonal skills in the communication with other actors in the healthcare system, in this project primarily colleagues on the one hand and patients and their caregivers on the other hand, we will see improvements in communication between actors and across departments in the healthcare system that will help to avoid or at least seriously reduce the likelihood of critical errors. That is, errors that would have serious consequences for the health and possibly life of one or more people. Among others, this project demonstrates that increasing awareness among preceptors of key ingredients of a psychologically safe environment, that is, an environment in which people dare to question and dare to share and discuss doubts and uncertainties with the idea of jointly improving healthcare practice, helps preceptors to contribute to such an environment for their residents. And an increased awareness among residents of this idea of psychologically safe environments can help patients to feel more encouraged to share information and feel understood better by their residents. This kind of interdependent chains, which take time to nurture, is a key theme throughout the book. Whether you are a healthcare practitioner, university teaching staff, involved in research and innovation projects in a healthcare context, or in a similar role in another type of high stakes professional environment, regardless of where you are based on the planet, if the matter of interpersonal skills is of your interest, you may want to check out this new book to find inspiration on how to move things forward. In addition, although this book focuses on the development of interpersonal skills, the build-up of the book and the way the project has been documented in the book also make this book interesting for anyone who has more of an interest in fostering other types of skills, such as clinical reasoning or really specialty specific techniques, skills, and competencies. If you have any question about the book, either now or once you are reading the book, feel free to leave a comment below the video or use the email address listed here to get in touch. Or if once reading you have a question about a specific chapter, you will see that each chapter lists at least one email address leading to at least one of the authors of that specific chapter. Having said, I hope you find this book preview useful. I hope you will also check out the book. And for now, thank you for watching, thank you for listening, and have a great day.